Welcome to Breakdown, Episode 7, Why Are Nurses Actually the Most Important Person in the Building?
All right, let's just jump right in. If I asked you who really runs a hospital, who's the first person that pops into your head? Probably some hotshot surgeon, right? The one you see in all the TV shows. Or maybe the hospital CEO, the person in the corner office with all the charts, for sure. But what if we told you that the most important person for your safety is actually the one you see the most? The one in the scrub.
When you're the patient, a hospital feels like the safest place on earth. It's supposed to be. You've got that clean, antiseptic smell, the steady beeping of machines. You feel like you're finally in good hands. And you are. But what you don't see is that a hospital is this incredibly complex machine. It's got thousands of moving parts and hundreds of people, all of whom have to be perfectly in sync. In a system like that, mistakes aren't really a question of if they'll happen, but when. The real question is, who's standing there to catch them?
And that's where they come in. Your guardian in scrubs, the bedside nurse. It's so easy to just think of them as caregivers, the person who brings your medicine, fluffs your pillow, checks your blood pressure. And they are, of course. But their most critical job, the one that can quite literally be the difference between life and death, is being that final safety net. They are the last line of defense between a mistake and you.
And the numbers on this are they're staggering. There was a huge study that looked at medication errors, and it found that about half of them were caught before they ever got to a patient. But here's the wild part. Who do you think caught them? My money's on the pharmacists. They're the experts on drugs. That's what I thought too. But nope. Of all the errors that were intercepted, a mind-blowing 85% were caught by nurses. Wow, 85%. They are the final checkpoint.
That's honestly the perfect way to think about it. An air traffic controller has to see the entire sky at once, right? Every single plane, every flight path, where they're going, and how to keep them from colliding. Well, your nurse is doing that for your care. They're juggling orders from 3 different doctors, watching lab results as they come in, coordinating with the pharmacy, all while keeping an eye on your vital signs. They're the one person who sees the whole picture and makes sure that one doctor's plan doesn't crash into another's.
And just look at the range of things they're catching. It's not all about meds, even though that's the biggest slice of the pie at 44%. Right, what gets me is that second one, procedural errors. That's nearly a third of all the saves. We're talking about things like stopping a procedure from being done on the wrong side of the body, or catching a charting error, a single misplaced decimal point that could have catastrophic results. They're basically professional fact-checkers in real time.
So let's make this real. What does this mean for you when you're lying in that hospital bed? It means your nurse is the one who gets an order from a doctor, looks at it, and has the courage to say, hold on, that dose looks dangerously high. They're the one who stops for that extra second to scan your wristband and make sure that the pill in that little paper cup is for you and not for your roommate. Or they're the one who realizes a critical dose of your antibiotic was never given. This is happening constantly, right at your bedside. So, we've established the safety net is powerful, it's strong. But what happens when it breaks? What happens when there are holes in that net? Well, that's when things get incredibly serious. And it brings us to this really important concept in hospital safety called failure to rescue.
Yeah, the official definition sounds a little dry, but the reality is anything but. Failure to rescue is basically when a patient starts going downhill, and the team doesn't catch it in time. Exactly. So you come in for a fairly routine surgery, but you start to develop a complication. Maybe your breathing changes just a little bit, or your heart rate creeps up. The rescue is when the team spots that early and steps in. The failure is when those signs get missed and a preventable problem spirals into a disaster.
And this is where the nurse's reality directly impacts the patient's experience. Let's just walk through this. On the nurse's side, you have high workload and interruptions. They're juggling way too many patients. The phone is ringing, alarms are going off. But for you, in the bed, you just feel ignored. Your call bell has been on for 10 minutes and no one's coming. Or how about fear of calling the provider? A junior nurse might be intimidated to call a senior doctor at 3 a.m. because they're afraid of getting chewed out. From your perspective, though, all you know is that something feels wrong and nobody is giving you answers. It's a perfect example of how the system's problems become your problems.
Okay, so we know the system isn't perfect. There are these potential holes in the safety net. So what do smart hospitals do about it? How do they give that bedside nurse the power to patch those holes? Well, they've created a way to call in the cavalry. And that cavalry is called a rapid response team. Honestly, the best way to think of them is as the hospital's special forces. They're an elite crew, usually a critical care nurse, a respiratory therapist, and a doctor, who are just on standby. If your bedside nurse gets that gut feeling that you're starting to get into trouble, they can hit a button, and that one call bypasses the entire normal chain of command and brings a medical SWAT team sprinting to your bedside in minutes.
The whole process is built for speed and, more importantly, empowerment. It starts with step 1. Your nurse, who is right there with you, detects those first subtle signs of danger. Then, and this is the key, step 2, they activate the system. They don't have to ask for permission. They don't have to wait for a doctor to call back. They make the call. That immediately triggers step 3. The expert team drops whatever they're doing and comes running. And their only job is step 4, stabilize you, right then and there before it becomes a full-blown code blue. The entire system is built on one simple, powerful idea: trust the nurse's instinct.
Okay, so this is all really interesting in terms of how a hospital works, but let's bring it back to the bottom line. Why should any of this matter to you? Right. How does all this behind-the-scenes drama, the error touching, the rapid response teams, actually connect to your experience as a patient, and even how the hospital's judged by the public?
So after you get discharged, there's a good chance you'll get a survey called HCHPS. You can think of it as the hospital's public report card. A lot of their funding can actually depend on these scores. Now just look at these categories: communication with nurses, responsiveness of staff, communication about medicines, discharge information. Who do you think owns all of those? Your nurse. Their performance isn't just a nice little bonus. It is literally the main thing that determines the hospital's public reputation. Your one-on-one experience with your nurse has massive ripple effect.
And look, if you need one last chilling piece of data to prove how important this is, here it is. A huge analysis of medical malpractice claims found this: 62% of cases where there was an issue with communication among providers resulted in a patient death. Just let that number sink in for a second. More than half the time that communication broke down, a patient died. It proves that the nurse is more than just a caregiver. They are the central hub of communication. And when that hub breaks down, the results can be absolutely tragic.
So let's put it all together. Your nurse is your guardian. They're your air traffic controller, and they are your #1 advocate in that building. Which brings us to the final, most important question. It's not just about what your nurse can do for you, it's about how you and your nurse can be a team. This is a partnership. So we want to leave you with this thought. Your nurse is your advocate. How can you be their best partner?